Public Health England is committed to global health security. Under the International Association of National Public Health Institutes, Public Health England is seen to be the second biggest national public health institute and is taking this role really seriously. And to them, and to me, global health security is very much part of our work to help to protect the nation's health and to make sure that we provide much better prevention and healthcare more widely. Public Health England has given me the great privilege of being the Vice Chair of the United Nations International Strategy on Disaster Reduction Scientific and Technical Advisory Group. And through being an observer on the negotiations, but also participating with the UN member states, I have been very much actively engaged with many partners across the world in supporting the fact that health, science and technology needs to be at the heart of the global agreement on disaster risk reduction. This global agreement came through in 2015 at the same time, at the year that we had the Sustainable Development Goals agreed and the Climate Change Agreement. It's a simple blue framework. It's quite thin, but the words inside it are so precious. It is really clear about having an all-hazards approach, engaging all partners, all science and technology, all government, all local government, all groups at NGO, at every level, to get involved in trying to reduce the impact of disasters. Because if we don't resolve disasters, we are just going to make the whole cycle worse and will make it much harder to deliver the Sustainable Development Goals and the Climate Change Agreement. It's been a privilege to be part of this. The framework is really clear. It has 7 global targets about reducing the numbers of deaths, the number of affected people, the impact on economic development, but also on how we improve basic health care, basic facilities, what the impact of disasters are on these. It talks about having improved systems for risk assessments so that we can improve our planning, for international development and aid, but also about how we improve early warning to all. And of course, global health security is very much part of making sure that we have early warning, and because we can only do that when we have a clear understanding of what the risks are. Inside that, there are 4 priorities for action: understanding disaster risk, better governance for disaster risk reduction, investing, but also better preparedness, response and recovery so that people are much more engaged in the whole story. These 4 priorities make it so straightforward for governments who are trying to work out how they would understand any system for all hazard preparedness and response. But it fits in completely with the global hazards, the global health security agenda, and making sure that it fits to deliver something that is as important within the health domain as it is across all the other domains that are engaged in hazard reduction. To me, global health security is something that is hard for many others outside the health domain to understand. We don't necessarily make it into a language that is outside the health professionals. We need to make it into a language that applies to all scientists, that it applies to all disaster risk reduction managers or responders, that we make it sure that it fits with the agendas that the UN heads of state are seeking to change to reduce disasters in the first place. If we can make it something that fits with the whole of the framework that I'm talking about in disaster risk reduction, then I think we will be in a position to really make a difference and allow our health, along with the natural hazard scientists, the engineers, those who do agricultural science, social sciences, the humanities, all of whom are engaged in delivering the whole of the all-hazard agenda. And if we're going to do global health security, we need to engage all. We now have these 7 global targets, and underneath them there are 38 indicators, which have been agreed by the UN member states and were published on the 2nd of February at the United Nations General Assembly and agreed and adopted there. These targets now require, with their indicators, reporting every 2 years. And by reporting on these, each country will be able to see how they are responding to, preparing for and planning to deliver this disaster risk reduction call, and can compare themselves within their own country, with their own local preparedness, with their own national preparedness, along with their regional and global preparedness. And that, we think, will really enrich the ability of each country to get engaged to deliver the Sendai framework. So I thought today's reflections on global health security made an invaluable workshop. It was inspiring, engaging, facilitating, but it raised the opportunity for me to try and broaden our views to make sure we engage more widely. To me, today has been the start of a process that I think would be really exciting if the BMJ could act as one of our leaders in taking this forward and demonstrating that the UK has much to offer and that we have much to share, but also that we can learn from many others and make sure that what we deliver is actually fit for purpose and it could be useful, usable and used.